Good morning. According to the World Health Organization, patient empowerment is defined as a process in which patients understand their role and they are given the knowledge and the skills to actively participate in their care. And of course, the question that arises is, what does this process actually include? In other words, what needs to be done? So in order to address this question, and within the context of our patient empowerment program, we have performed a qualitative study with semi-structured interviews among patients sharing the same diagnosis, the diagnosis of chronic lymphocytic leukemia. The main question was, how do patients with chronic lymphocytic leukemia experience their disease and what do they need? And of course, the interviews were done with the help of the Greek CLL patient organization. They were conducted by health psychologist Christina Karamanidou, and so far we have performed 29 interviews. The replies that we are receiving from the patients are beginning to repeat themselves, so the study is reaching to its completion, but you will hear more about the process from Christina later on. The interview guide included 24 open questions. The issues that we explored were around diagnosis, the first reactions that the patients had, their patient-physician interactions, and of course, the overall impact that the diagnosis had on their everyday life. So, what is chronic lymphocytic leukemia? Chronic lymphocytic leukemia is a cancer, hematological cancer, that is characterized by an increase of white blood cells, and more particularly one specific type of white blood cells, the B lymphocyte, and that's the word lymphocytic leukemia. It has a prolonged clinical course, with almost 83% of all patients reaching a 5-year survivorship, and that's the word chronic. CLL represents 1.1% of all cancers in the United States. It is one of the most common leukemias of the adult population in the West. Median age of diagnosis is 72 years, and yes, CLL is a disease of AIDS individuals, and as you can understand, those individuals also have other health issues. But the diagnosis is not so uncommon among younger individuals, aged 55 years old or younger. Up to today, we still don't know what causes CLL, so there's no way to prevent it. We know that it is not a contagious disease, and we know that in some families more than one people are affected, yet we still don't know the reason. For most patients, the diagnosis often comes as a surprise, as almost 80 to 85% are asymptomatic at the time of the diagnosis, and the diagnosis is mainly suspected by increased blood counts, increased lymphocytes in a routine blood test. For the rest of the patients, symptoms may vary. The most common symptoms are lymphadenopathy, that is enlarged lymph nodes or enlarged spleen. CLL is characterized by extreme clinical heterogeneity, so some patients may experience a very indolent disease with long survival, whereas some others may experience a very aggressive disease that is not responsive to treatment. And we know that this clinical heterogeneity most likely reflects the underlying biological heterogeneity of the disease. Up to today, there is no curative treatment, even though we are moving toward that direction. And one other thing that it is rather interesting about CLL is that the diagnosis of the disease itself does not mean treatment initiation. The decision for treatment initiation is based upon certain criteria that needs to be fulfilled. So in other words, patients with CLL have to face the fact that they are diagnosed with a cancer. They may have symptoms, they may have not symptoms, they may receive immediate treatment, but they may not. And moreover, there are not definite answers to their questions. So, let's see the replies that we received from our patients. All patients described the time of the diagnosis as a shocking experience, mainly because of the name of the disease, the term leukemia, and the consequences that is associated with. And you can see the quotes from patients themselves. I got stuck at the word leukemia. I didn't listen to anything else. I didn't know what it is, chronic, acute, so it's the word. But then patients described that at that time, they found comfort at their physician's words like, this is a good leukemia, and this is the only thing that you should not worry about. After the shock came the depression, and patients described the sad feelings they experienced and how they managed to get over those feelings, mainly with the support of their families. What they couldn't understand is how the term leukemia can be associated with the concept of a chronic disease. And moreover, how can they be diagnosed with a cancer but not receive any treatment at all? And you can see the quote here. There's no question about the diagnosis, but do we just leave the disease to evolve? What if it gets out of control? And indeed, literature has shown that patients with CLL and the watch and wait arm, that is, patients who do not receive treatment, experience the same level of stress, depression, and they have the same quality of life with those patients who are receiving treatment. After they came to terms with all the above, most patients described that they made none or just minor changes in their everyday life. But there were a few patients that described that they have limited their social life, mostly because they were afraid of infections. When we asked our patients if they feel healthy or if they feel ill, what they said is that in the absence of any symptoms, they feel healthy. Yet most of them described that whenever they had the chance, they checked themselves to see if something new has arisen that may reveal the presence of the disease. And also this has been shown in the literature where 56% of all CLL patients are found to think about their disease every day. The fact that they were feeling healthy, the fact that they didn't have any symptoms, restrained them from revealing the diagnosis to people who are not members of their families. And there was actually one patient that described that she had problems in her work when she tried to explain to them their disease because they didn't believe her. So what are our patients' worries and needs? Of course, one of their major worries is the unknown future. They know they have the diagnosis, they know they're feeling well now, but they don't know what's going to happen in the future, and moreover, they don't know when this is going to happen. They have a lot of questions, but they cannot find answers to all of that questions. And there was a patient that actually suggested that there could be a support line with information available. Questions concern aging, what happens next, what happens with aging, but also treatment, drug availability, what happens when I need treatment, are there going to be available drugs, and what happens if I don't respond to one therapy, am I going to be able to receive another one? Patients want a more holistic approach. They don't want only hematological counts to be taken into account, but also they want their appearance to matter. They need to come in close contact with other patients so they can exchange their fears, their worries, their experiences. Of course, time is a very serious issue. Patients know that their physicians are overloaded. They can see that other patients are waiting for to see their physician also. So what they do is that they tend to prioritize their questions. So mainly they ask questions concerning the disease or the treatment, leaving out questions that seem less important but actually affect their everyday life, questions like sexuality. All patients were very happy with the support they received by their physicians, emotional and physical support, and they all developed mechanisms so as to cope with their disease. So, in conclusion, after all that, what do patients need? The most important factor seems to be information that should be provided to them in many different forms, either written or shown in other ways. They need the language to be simple. We need to avoid terminology, and the meaning should be clear so as to take off all the questions. And of course, the information must be tailored to patients' worries. Much of the information and, of course, the support will be provided by the physician, but then we have the question, are physicians willing and able? And this is actually the title of one of the talks that we are going to listen later on. Peer support, they need to come in close contact with other patients that share the same diagnosis, and of course, they need to be reassured that they are going to get all the care they are going to need in the future. Thank you.